Okay, so we have a PCA order for morphine for Miriam Redeem who has fractured ribs. Hi Miriam, my name's Clare and I'll be the student nurse looking after you today. Now I can see here that you've got some fractured ribs, which I'm sure is quite painful. So the doctor has ordered you some morphine, which I'll be able to get all organised for you today. Just so I can do that, can I please confirm your full legal name?
Miriam Redeem.
Thank you. And your date of birth?
7th of the 1st, 1969.
Perfect, thank you. And your MRI is 174963, 174963. And do you have any allergies?
No.
Perfect, thank you. Now Miriam, with your pain, so 10 being the worst pain you've ever had and 1 being no pain at all, what is your pain score?
8.
Okay, that's definitely not good, so in quite a lot of pain. And I'm just going to quickly take a look at your cannula site now. Is it sore at all?
No.
No, and I can see no redness and there's no swelling at all, so that's definitely the cannula we can use today. Okay, Miriam, I've also done a baseline of your vital signs. So what we'll do is once we've started up the morphine, 15 minutes after it's commenced, I'm going to come back and do a second set of vital signs on you as well, just to see if that morphine is taking effect, okay? All right, Miriam, like give me about 10 to 15 minutes. I'm just going to go and organise all your morphine and get everything ready. And I'll be back in a minute. Okay, so I'm just going to validate my order now. Okay, so we have Miriam Adib. Yep. MRN is 174963. Her date of birth is the 7th of the 1st, 1969. This is for fractured ribs. She has no known allergies. Now, this drug order is for morphine, 50 milligrams and 50 mils. It has been signed and printed by the doctor, but has not been given as of yet.
Yep.
So this PCA order is 50 milligrams morphine in normal saline 50 mils. Okay, so the concentration is 1 milligram per mil. The number of syringes is 3. The PCA dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour. And the hourly dose limit is 12 milligrams. And the doctor has signed for that. Now down here, the doctor has ordered some other medication just in case. So for nausea, we've got metoclopramide, 10 milligrams IV, TDS, which has been signed and dated by the doctor. Now this is for if she becomes nauseous. And naloxone for 0.2 milligrams IV, which is for 2 to 3 minutes, which has also been signed and dated for the doctor, and that's in case we accidentally overdose her. And again, it hasn't been signed, which means it hasn't been given yet. Okay?
I agree.
Thank you. Okay, so I'm just checking my mins so we make sure we've got everything, we know everything, what morphine is for. So morphine is a narcotic analgesia, okay, so for pain relief. I know that the dose the doctor has ordered is definitely within the therapeutic range, and the most common side effects are hypertension, respiratory depression, and also nausea as well. So the doctor has definitely taken that into consideration. And yeah, all good. Okay, so I've gathered all my equipment. So what I'm going to do now is we're going to collect my morphine that I need. Okay, so I'm just going to open up the cupboard. Alright, so firstly I'm going to count how many I need. So at the moment you can see here that is 45 in the balance, sorry, is 45 ampules. So the first thing I'm going to do is going to count the ampules. Okay. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's 10, 20, 30. 1, 2, 3, 4, 5, 35. 1, 2, 3, 4, 5, 40. 1, 2, 3, 4, 44, 45. Okay. So when we look at the ampules, we can see here that it's 10 milligrams in 2 mils. And if we compare it to our drug order here, so morphine is 50 milligrams. So as it's 10 milligrams, we'll need 5 ampules. So 10, 20, 30, 40, 50 milligrams. Do you agree?
I agree.
Perfect. Okay, thank you. All right. There for a moment. Now I'm going to complete my first drug check. Okay, so as you can see here, we've got Miriam Adib. MRN is 174963. Date of birth is the 7th of the 1st, 1969. It's for fractured ribs. She has no known allergies. Now the drug order is for morphine, 50 milligrams in 50 mils. It has been signed and printed by the doctor and has not been given as of yet. Okay, so it's a PCA by IV morphine for 50 milligrams morphine in normal saline 50 mils. So the concentration is 1 milligram per mil. The number of syringes is 3. The PCA dose is 1 milligram. The lockout interval is 5 minutes. The basal infusion is 0 milligrams per hour, and the hourly dose limit is 12 milligrams, and it has been signed by the doctor and again has not been given. Okay, so now we're going to look at our morphine. So the morphine sulfate injection is 10 milligrams in 2 mils, and expiry is October 2020. If you look down, as you can see, they're all the same. Right, so 10 milligrams, 10 milligrams, 10 milligrams, 10 milligrams. Okay, and we're going to be mixing that in with 40 mils of sodium chloride. So we've got sodium chloride injection, 0.9%, 90 milligrams in 10 mils, and the expiry is August 18. And again, if you look down, oh, no, that's not right. So August 18, September 18, September 18, September 18, September 18. Do you agree?
Yep.
Perfect, thank you. Now I'm going to complete my drug book. There's my S8 book. So we've got 10 on the 5th, 17. The time is 1:30. This is for Miriam and Dib. Okay, so we need 50 milligrams. Okay, so now what I'm going to do is I'm going to count the remaining balance. So as we've taken 5 ampules from the drawer, from the cupboard, I'm going to count the remaining to be sure we've taken the correct amount. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10, that's 20, 30, 1, 2, 3, 4, 5, 35, 1, 2, 3, 4, that's 39, and last one equals 40. So as 45, we've taken 5 from the cupboard. So that means we have a balance now of 40, and this is from our hunt. And if you agree, can you please just sign off on that as well? Okay, now it's all correct. I'm going to put the 40 ampules back into the cupboard, and I'm going to lock it up. Okay, so now I'm going to draw up my 10 mils of morphine firstly into the syringe. That's 10 mils of morphine. Do you agree? That's 10 mils of morphine. So I need to add a remaining 40 mils of saline to equal the 50 mils. I've done full 50 mils. Do you agree? Now I'm going to complete my additive label and fill that out. Okay, so if you agree, can you please just sign here for me? Perfect, thank you. Okay, now I'm going to just add that onto my syringe. On my syringe.
Yep.
Perfect. Okay, so now I'm going to complete my second drug check. So we have Mary Madib, MRN is 174963. The date of birth is the 7th of the 1st, 1969. This is for fractured ribs. She has no known allergies. Now the drug order is for morphine, 50 milligrams in 50 mils. It has been signed and printed by the doctor but has not been given as of yet. So the PCA is IV morphine for 50 milligrams morphine in normal saline 50 mils. Concentration is 1 milligram per mil. Number of syringes is 3. PCA dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour. And the hourly dose limit is 12 milligrams. It has also been signed by the doctor. So just give me 1 second. I'll just quickly fix these up. All right, so we've just got here, so morphine sulfate injection, 10 milligrams in 2 mils. And again, if you just look down, so that's all 10 milligrams, all expiring on October 2020. And that also totals up to 50 milligrams. And that has been diluted with 40 mils of sodium chloride. So sodium chloride injection, 0.9%, 10 mils. So the first one expires August 2018, and then the second and the rest is September 2018, as you can see. Do you agree?
Yep.
Perfect, thank you. That's my second drug check. Oh wait, and hang on, let me just quickly better my syringe. So we've got 50 mils in total, as you can see. So 50 mils, and we've also completed our additive label correctly and been signed. Okay, second drug check is complete. Okay, now what I'm going to do is I'm going to prime my line. as you can see, my line is now primed. So now what I'm going to do is my third and final drug check. So we have Miriam Adib, MRN is 174963. Date of birth is the 7th of the 1st, 1969. This is for fractured ribs and she has no known allergies. So the drug order is morphine, 50 milligrams in 50 mils. It has been signed and printed by the doctor but has not been given as of yet. The PCA IV morphine is 50 milligrams morphine in normal saline 50 mils totally. So the concentration is 1 milligram per mil. The number of syringes is 3. The PCA dose is 1 milligram. Lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour, and the hourly dose limit is 12 milligrams. And again, it has been signed by the doctor but has not been given. Okay, so now we have morphine sulfate injection, 10 milligrams in 2 mils, and expiry is October 2020. And if you look down, you can see they're all the same. So 10 milligrams times 5 ampules equals 50 milligrams. And we have mixed that with, diluted it, with sodium chloride 40 mils, so 10 mils. The first ampule is expiring is August 2018, and the following 3 is September 2018. And yeah, so it's been diluted, so that's totaling to 50 mils. As you can see, we have in our ampule here, so 50 mils, and our additive label has been completed correctly and added to our syringe. Good. All right, hi Miriam, I'm back here with your medication. Now, before I'm able to administer this to you, just one more time, can you please just confirm your full legal name for me? And your date of birth, please?
7th of the 1st, 1969.
Perfect, thank you. And I can see here your MRN is 174963, 174963. And do you have any allergies?
No.
No? Perfect. All right, so Miriam, what I'm going to do, I'm just going to be silent for a couple of minutes while I get all this PCA set up for you. And then I'll explain, the side effects and how it all works and how you'll be administering it, okay? Perfect. Okay, so we'll clear the previous history of the previous patient. So it's already on morphine, which is 1 milligram, which we've already calculated. And the lockout dose is already 5 minutes. Continuous is 0, which we've done, and the loading is 0, which is all correct. Now down here, the maximum dose is 16 milligrams, which we want to modify. Okay, so we want to go down here because it's actually, according to our chart here, is 12. Okay, so we'll go down here. So max limit, alter. We want to go down to 12. Confirm. Okay. All right, so now we can see that has changed to 12, which matches our order here. All right, perfect. Okay, so what we're going to do now is I'm going to attach it to my patient. Okay, I'll clean my hands once again. I'm just going to put my gloves on. Okay, so Mary, I'm just going to clean your cannula side. Now, as I said before, it is definitely looking very good, so we'll be able to use that today. I'm going to clean it for 15 seconds, so it's definitely all clean and good for me to use. Okay, perfect. So I'm going to attach it. Alright, I've just connected your cannula to, the line to your cannula. So what I'm going to do now is I'm just going to secure it. Okay, so it doesn't dislodge or anything. Very secure. So we'll just put another bit of tape on. Just one bit of tape here too. All right, all secure. Perfect. Okay, so Miriam, I'm just going to give you this green button. So what this does is every 5 minutes it'll illuminate green. Once it's illuminated, you're able to press it, and then it will administer yourself a dose of morphine. Okay, right. So I'm just going to leave this in your hand. Now, do you have to let you know only you can press this button? So no family or staff can actually press this button. Only you can. All right, as it's self-administering. Now, just in terms of side effects, you can feel a little bit nauseous with this. Also, other things like respiratory depression and hypertension, but the main one is nausea. Now the doctor has also charted something for that as well, so please just let me know if that does happen. So I will come back in about 15 minutes to complete your vital signs and just also to see how you're going as well. So please let me know in the meantime if there's anything else I can do for you, and here's your buzzer. All right, is there anything else I can do for you now?
No.
Okay, perfect. So I'm just going to press start. On and start. Alrighty, perfect. All up and running. Okay, thank you, Miriam.
Thank you.
Okay, so I'm just going to complete documentation now. So the date today is the 10th of 5th, 17. The time up is 1:45. Just sign here. Good. Okay. Saf, if you agree, can you please just sign there for me? Perfect. All done.